does Medicare calculate the value of reimbursement for each Medicare client that you enroll? Stay tuned in this video and I will explain it. Medicare risk scores is something that insurance agents don't really see. This is kind of how the sausage is made, and this is definitely something that members don't see. But this is how insurance companies make their money. So if you are truly an expert in the senior market, or you aspire to be, this is something you need to pay attention to, and this is a kind of a short video, kind of a simplified version of it. But the way it works is Medicare assigns a risk score, got my braces on, to everyone that you enroll into a Medicare Advantage plan. And based on how healthy or how sick they are, that's how much money the insurance company gets to manage the health of that member. So let's say you are let's say you're the typical male, in my opinion, that's turning 65 and he hasn't been to the doctor in 10 years. And so he hasn't had any prescriptions and apparently he's super healthy, right? So he might have a risk score of 0.03. So we'll say it's a really low risk score. So the insurance company might get like $6,000 a year to manage him. Now, if he's truly healthy and he doesn't need any prescriptions and he doesn't need to see the doctor but once a year, they could make a lot of money on that guy, right? However, that guy could also be a ticking time bomb. Right? He hasn't gone to the doctor in 10 years, but he does have undiagnosed diabetes, he does have uncontrolled blood pressure, and he does have high cholesterol, which a lot of people that haven't been to the doctor in 10 years at age 65 do in this country. So just the fact that he hasn't been to the doctor means there's nothing on record. There's nothing they can check to see what this guy's health is. So the insurance company is not going to get that much money. The amount of money they get, again, varies on the county that they are across the country. So let's just say approximately $6,000. Now, let's say that my next person, I clean up my board here, my next person is really sick. So this person, the score is going to be like a 5, okay? Because this person has diabetes, cholesterol, COPD, Parkinson's, leg amputation, macular degeneration, diabetic retinopathy, a lot of stuff. And we've all had those clients too. And you see those clients more often on the dual SNP marketplace. So that person has a lot of illnesses, and it's all verifiable because CMS knows everything. They control all the costs. So they know exactly how sick you are, how often you've gone to the doctor, what scripts you're on. And so, boom, this person might end up getting the insurance company a reimbursement of, let's say, $17,000. I think it's actually a little lower than that, but a lot more money. Well, you're saying, yeah, but that person's really sick. The insurance company's got to spend a lot of money on that person. Did you wonder why D-SNPs are so fastly growing? That's where all the insurance companies are putting their effort. That's where most of the expansion is. And they're really throwing a lot of money in extra benefits. They want to get these people that they can get a lot of money, and then they want to make them healthier. They want to impact their lives and produce a healthier outcomes. Take this money and get them those doctor visits, get them the flu shots, get them the mirrors to check the bottom of their feet to make sure they're not getting diabetic sores. Go out to their house and do assessments and try to help these people quit smoking, lose weight. Because if they can save a lot of money and be very profitable, right? So you need to understand everybody on Medicare has their own score. So you'll have your own score, which is kind of scary, right? And when you come on to Medicare, they know what your score is. But like I said, based on this guy over here, it might not be accurate because that guy just hasn't gone to the doctor or hasn't followed up. So that's why the insurance companies really want the agents to get involved here on the health risk assessment. So the health risk assessment, HRA, is what Centene Allwell pioneered. And they said, hey, agent, when you're done selling the Medicare Advantage plan, call this number, put the client on the phone, and then you leave because of HIPAA. We don't want you to talk. We don't want you to be available while they're talking about their health. And then we want to ask them, hey, do you have any of these other things? What's going on? So that the insurance company can try to get more money because that person is actually sicker. And they should get that more money. It takes them about 18 months to get the adjustment. So there's a lot going on here with the risk scores, which is why if you're a student of Medicare, you might remember that there are quite a few whistleblower lawsuits that are out there, and you can Google it. I think most of the major insurance companies have had some involvement embroiled in this litigation because of playing with the risk scores. And that it was taking somebody and going, hey, he's not really a 0.3. Because nobody's a 0.3. Nobody at 65 is a 0.3. He probably just hasn't gone to the doctor. So let's put him in as a 1.03. So there's been a lot of litigation saying that people were artificially inflating the risk scores. And it might be more information than you're really interested in, but I just wanted to let you know as an insurance agent a little bit behind the scenes how this works for the insurance company. Happy selling. If you want to know more about Medicare, stay tuned. We have a lot of great videos on our channel.